My name is Dick Ongley. I'm a specialist anaesthetist in Christchurch. I work in public and private healthcare. I have been a member of the Perioperative Mortality Review Committee for approximately 5 years, and in the last year I've had the good fortune of taking over the role as chair. The Perioperative Mortality Review Committee, or POMRC as we call it, is a group of health professionals and a consumer representative who come together approximately 4 times a year to look at what we call the National Minimum Data Set, which is information about people having surgery around New Zealand. We are looking for any signals which might suggest a change in the level of healthcare for surgery provided. At the end of the year, we produce an annual report discussing the safety of surgery in New Zealand and trying to highlight any areas of concern which we would then ask health providers to examine. What we wanted to do was create a website or a page where people from the public could go on and have a look at surgery, maybe even have a look at their potential surgery coming up and the safety of that surgery. We thought it was vital to also provide information to people so that they could have some links as to who they could go and talk to if they had any further questions. So that is what we termed level 1, or the infographic. Level 2 is what we've termed the Explorer. It's an interactive dashboard for health professionals and perhaps people involved in quality assurance and academics to explore the data in their own time rather than relying on our previous annual reports. Hopefully it would highlight an area to them which they could then go and examine themselves. So I often get asked about what inequity is. So the way I think about it is that all people are different, and what we're trying to do is make sure that everyone gets the same outcome from their surgery, the safest possible surgery. And so we have to recognise that some groups need more resources, whether that be access to a GP, medications, specialist surgeon. They might need more of a certain thing to get the same outcome. And so that is what we're talking about when we're trying to improve inequity in surgery. Level 3 is going to be an automated surveillance function where the national minimum data set is being constantly surveilled to see if there are any unusual changes in mortality. For example, more deaths than expected for a certain surgery or a certain area. Our intention is that would be then notified to a group of health professionals who would start to look into what is happening in that area to determine if that really is occurring, and then we would act more quickly on that to create change in that area.